So there's tremendous advances happening in the field of AI on a day-to-day basis. And healthcare as an industry we know is ripe for innovation. Access, outcomes, and quality are pretty bad, and costs are exploding every day. So AI could lend a huge shot in the arm to improve all of these things. However, given how vast healthcare field is and how complicated it is, it could be overwhelming to think about the best areas for AI use cases within healthcare. So here's a framework to segment the healthcare space that I thought could be very helpful. It's called the PPNCC framework. We're essentially dividing the healthcare space into patient-facing on the left, provider-facing use cases on the right, non-clinical on the bottom, and clinical space on the top. So we're dividing the healthcare space into 4 quadrants. Now there are other areas like the payer space, the pharmacy space with the drug discovery and all that, the government space, etc. While there are large use cases in these areas, the sheer volume of use cases tends to be high in the patient and provider facing areas because of the number of players being so high. So let's look at the bottom right quadrant first, the non-clinical provider facing area. This tends to be one of the low risk areas, so a lot of companies start here. So let's think about what are the highest value areas within this space. What could they be? There are things like transcription, coding, billing, appeals, payments posting. This is all the back-end revenue cycle management area, scientific research. All these are good areas where AI could help. Now let's go to the bottom left quadrant. That's the patient-facing non-clinical space. And some of the areas here, just finding care, finding the right provider for yourself, scheduling with the provider, drug delivery, question and answers with the providers like the pre-op and post-op support or follow-up questions after your appointments, things like that. And health education, of course, is a big space. Now going to the clinical provider-facing space, these could be some of the areas. Lab result analysis, big area, of course, AI could help there quite a bit. Imaging analysis, there are a lot of companies working in this space. In-basket messaging, the epic in-basket messaging, the bane of a lot of providers' existence because it's very time consuming and there's a high cognitive burden on these. There's the diagnostic co-pilots. There's also a lot of work going on in this area. And of course, documentation, actually generating the clinical notes based on the provider's verbal notes. Then finally, the clinical patient-facing area, you have spaces like chronic disease management, mental health support, huge area of concern right now, addiction therapy, medication adherence, personalized health monitoring, health assessment, and things like that. So those are some of the areas. Now let's look at some companies that are actually innovating in these areas. Again, the same framework, patient, provider, non-clinical, clinical. And starting with the bottom right again, here are a few startups that are innovating in this area. And a couple that I want to highlight. One is DeepSix AI. It is a AI-based patient clinical trial matching software. It helps providers basically look up which of their patients qualify for which clinical trials based on the complex inclusion and exclusion criteria that is kind of buried within the clinical notes, within the pathology reports and things like that. So great company doing great work there. Abridge is another company that works in the ambient listening space and making transcriptions. So that's another company to keep an eye on. Cohere Health, also a startup that's seen good success, operates in the pre-authorization space. Now moving on to the patient-facing non-clinical space. Here are some companies that are innovating in this space. And one company that I want to highlight here is VitaDio, which is basically app-based therapy for type 2 diabetes. So it's to help reverse insulin resistance by using AI-based lifestyle modification recommendations. Great space to make a huge impact. Now moving to the clinical provider-facing space. Here are some companies that are operating in that space that have seen good success And one company that I want to highlight is Rayscape, which is AI tools for radiologists. So it improves the accuracy of X-ray and CT scans by using this deep learning model that's been trained on millions of messages. So you've heard the saying, right? AI will not replace radiologists, but radiologists that use AI will replace radiologists that do not use AI. So that's the space that Rayscape operates in. And finally, moving to the clinical patient-facing space, here are a few companies that are operating in that space. And one company that I want to highlight is StethoMe, which is a smart app-based stethoscope that parents can use to listen to their kids' lungs. And right on the app, it'll show you very clearly what it found based on the sounds that it's hearing. And you can even record these sounds and send them to your provider, and your provider can make recommendations virtually without actually physically seeing your child, which is amazing. So those are some of the areas where a lot of work is happening. Of course, these are just a few. There are thousands of areas within this landscape that AI could help with that could make a real difference in cost, quality, outcomes, and access. So by segmenting the space into quadrants like this and looking at use cases in each of these areas, we may be able to think better about the best places where AI could help. So hopefully that helps. That's the PPNCC framework, patient, provider, non-clinical, clinical space. Whether you're in healthcare or not, if you want to discuss AI or strategy in general, feel free to reach out. I'd be happy to discuss.